Hi, I'm Dr. Larry Burchett. This video is for folks who have panic attacks. In the middle end of this video, I'm going to walk you through what to do when you actually have a panic attack. And I'm going to try to approach this as I do with the patients that I've had success with being able to break their panic attack without having to use medication. But first, before we get to that, I want to talk a little bit about what a panic attack is and some things that I want you to have in your mind that's very important so that you are prepared for the next time, so that you're mentally ready and you've got a plan of what to do the next time this thing happens, because this pregame, this preparation can often be more important than what you actually do, what you think and experience when you're going through this. I'm an ER doctor. I've been doing this over a decade. I have attended hundreds, maybe thousands of people who have had a panic attack. I understand and know it is awful. A panic attack feels like you're dying, like there's something so wrong that you're dying, whether it's chest pain, shortness of breath, numbness, tingling. People commonly feel like they're having a heart attack or a stroke and that something is very, very wrong. Now, the first piece of good news that I want you to put in your head, I'm gonna teach you a mantra, okay? The first piece of news, and this assumes, by the way, that you've been evaluated, treated, we have a clear diagnosis of panic attack, and it isn't a heart attack or something else serious. But for most people who have recurrent panic attacks, we have an established diagnosis. So if you don't have that established diagnosis, you need to go see somebody and make sure we've got the right diagnosis. But assuming that you do, the first question I have for you, if you've had recurrent panic attacks, is, I know you're experiencing these feelings that it's something serious and that you might die, you could be permanently injured. That's what it feels like in your body. But what happened? What happens with the panic attack? You survive. Every time it is something that you survive, you get through. It does not kill you. You are a survivor. Feels terrible. It can be the worst feelings that you experience, but it's not damaging to your body. It doesn't permanently injure you like a stroke or a heart attack would. And that's great news, because when this is happening, when this panic attack is happening, your mind sometimes people even say it. So sometimes I have people who have a little bit of a symptom and then they worry that it's something horrible, and then it spirals into this panic attack. And once they're kind of in this tornado where their body feels like something's wrong, and then their mind says, oh my God, is something wrong? Am I dying? It just continues. That feedback loop back and forth continues to spiral out of control. And so one of the points in that feedback loop we need to interrupt. And the way that we're going to do that is by putting in a couple of beliefs. And one of them, it's true, which is you have survived. And I want you to imagine the next time you go through a panic attack, that you're going to feel your body. It's going to have those sensations. You can even imagine this a little bit. But it's to say to yourself, what happened last time? I survived. I'm going to be okay. This is not going to kill me. Pick some mantra in that makes sense and resonates to you, and pick that as your mantra. And I want you to be able to repeat that and to say that to yourself, even if you don't believe it in the moment, because your body is going to be telling you something else. Your body is going to be freaking out. It's the surge of adrenaline where you're hyperstimulated. Maybe you're triggered back into a trauma or something very, very awful that you genuinely have experienced in your life. We need to have a strong belief in there based in your reality, which is you survived. You're resilient. This thing that you're experiencing, this panic attack, did not kill you. You survived. It's not going to kill you. It's not even going to hurt you. It's going to be can be very uncomfortable and displeasant. It's not going to kill you. You're going to survive. It's going to hurt you. Pick one of those, and that's going to be part of the mantra. Okay, it's actually the second part, but I wanted to introduce that to it. Now, the next question I have, this is the second part of this, is in the moment. So not only do you feel like you're going to die and have really intense bodily sensations and symptoms, but you also have this feeling and the sensation that it's never going to end, that it's eternal almost and finite. I haven't had a ton of panic attacks, but when I've had incredible anxiety, one of the worst parts about it was feeling like it would never end, and I was trapped and powerless and there was nothing I can do. That was horrible. And the most helpful thing, again, I half believed it at the time, was saying and repeating like a mantra, almost meditating, this is going to end. This is not going to last forever. This is going to go away. And it's going to be okay. That feeling of anxiety and the intense everything, it's going to go away. Look at your own experience. I'm not telling you something that you don't know. You look back at your prior panic attacks, how long have they lasted? Some are minutes, half hours. Some people do last longer, into the hours. Whatever it is, did it last forever? No, it went away. It's kind of one of these, and it goes up, and then it goes down. It's like a wave running through you. You may even play with a little bit. Instead of resisting in the horrible, just like relaxing and letting it run its course like a wave, like letting it pass through you. I know this stuff is easier said than done, but I want to load in your mind now the two things. So the first one that I would lead with is what we just talked about, saying to yourself, this isn't going to last forever. This is going to go away. And then the second thing, this is not going to kill me. I'm going to be okay. I'm going to survive. Pick a mantra out like that and start to repeat it over and over and over and get it so that the next time you have a panic attack, you can go right there and you can say, okay, it's going to come and it's going to go. This is not going to last forever. It's going to go away and I'm going to be okay, because you are. That's true, and you know that to be true. And I've had so many patients where we've gotten through it, and at the end, they feel so much better, and they've gotten through the wave of the panic attack, okay? Now, some of the things that I do think some people have different kind of opinions on this. I do think a couple other things in the middle of the panic attack can be helpful. Number one is breathing, and number two is distraction. So for breathing, this panic attack, when you have these symptoms, it is adrenaline like this. And when you breathe fast and you hyperventilate, it just keeps your adrenaline at that high level. We need something, anything, whatever. I'm open to whatever you can do to lower that adrenaline and get that out. Because as that goes down and your body feels safe, it no longer feels threatened and in this kind of incredible, am I dying state of hyperadrenaline where you're ready to act, but you're just trapped in that cycle. One of the best ways to literally reverse the adrenaline and get it out of your system is deep, controlled breathing. And the great thing about it is you don't have direct control over these symptoms. And that's one of the worst things about it, is that it's outside of your control. But you always can control your breathing. And by controlling your breathing, indirectly, it will lower the adrenaline out of your system. It will let your parasympathetic nervous system take over and relax you. You can't do it every time. Sometimes we have to use Ativan, but this is a great strategy. So you've got your mantra, and then this is what just something simple. Deep controlled breath in for 3 seconds. Hold it for a couple. Let it out. Deep controlled breath in. Hold it for a couple. Let it out. Now, the next thing I want to go to along that is a little bit of distraction, where I want you to focus as you take that deep breath in. I want you to squeeze and tense up, okay? So deep breath in, squeeze your fist, tense up. You can tense your whole body. And then as you exhale, relax all of that body. In, tense. Pause. Exhale, let go, relax the whole body. Do 10 of them. And focus on tense and tight, making everything as awful as possible, then let go. We got your hands as part of this. And I want you to do with your feet, pull them up like this. I did this with a patient just yesterday, and I had her alternate her feet. You can try that. But for this one, as you do this, I want you to tighten this way, tighten every muscle in your body, and then let go. and do that 10 times and see where you're at. Breathing and this focus on controlling, again, something you can control. It's going to give you a sense that you're in control. It's going to bring down that adrenaline that's so out of control. Other things that you can mix in there. You can play with your breathing. You can do different things. You can change your setting. Get out, go for a walk, call somebody on the telephone, break it. These things are often very, very difficult to do in the middle of a true freak out panic attack. But I want you to think about all of those other things. Additionally, things that can lower your threshold. Sometimes it's stress, kind of raises the level. Most of my patients tell me when they get a panic attack, it's not provoked by any one thing. It's not like they get in an argument and then it's a panic attack. Sometimes it is. But most of the time it's random and it just comes on and there's no identifiable cause. But that said, having an increased stress level throughout the week and the month can certainly contribute to it and predispose you to have it. So work on all of the things to lower your stress level. Again, the cognitive behavior stuff like we talked about, being ready, exercise and sleep are huge for lowering all that stuff. That's another conversation altogether. So I'm going to walk you through exactly what I would do if you had a panic attack in this moment. You can feel free to kind of jump to this. I may do another video where I just do what I would do for you in the moment, but I am going to tag it on the end of this one and do it. So, okay. So you've got a panic attack. I want you to look at me right here. You're going to be okay. You know that, and I know that. You've been through this before, and you know these symptoms are very intense. Your adrenaline is very high. I want you to start doing what you can do, what you can take control over, and let's start with your breathing. But I want you to remember, the last time you went through one of these, you got through it. You were okay. And it was temporary. It went away. I know it's really intense right in this moment. Your adrenaline is shooting high. So this is what we're going to do to bring that down. I want you to close your eyes and focus on your breathing. Take a deep breath in for 3 seconds. Pause. Let it out. Deep breath in. Pause. Let it out. I know it's intense. We're going to keep doing this. You got to stay with me. It's not going to go away like that, but we are going to get it over the course of minutes. We're going to get this feeling in a better place because you know you've been through this before. I want you to continue your breathing as I'm talking to you. You've been through this before and you've come out okay. You know it's not going to be forever. It's temporary. It's going to go away. Let's do another breath in. Pause. Let it out. Now this time with the breath in, I want you to clench your fists and squeeze them really hard. Deep breath. Squeeze. Pause. Let it out. And relax your fists and let it out. Let's do 2 more of those. Pause and let it out. I know this is hard. Stay with me. We're going to keep doing it. Even we can just bring it down a little bit. It'll help you feel a little better. Deep breath in. Squeeze your fist. Pause. Relax. Release your fist. And as you release your fists, imagine all of that tension going out with it, and you're letting that anxiety go. You're letting that panic attack go. Deep breath. Squeeze the fist. Pause. Let go. Relax. Now I want you to involve your feet. Pull your feet up 2 at the same time. Deep breath. Squeeze your fist. Pull your feet. Pause. Let go. Let your feet go down. Release your hands. Same thing. Deep breath. With the feet and your fists. Release. We'll do 3 more. And release. Remember, this is going to go away. You're going to feel better. This is not going to last forever. You've survived this before. You're going to survive this again. And relax. Again. And relax. Continue doing this. It may take 10 or 20 minutes before you feel some relief and feel better. Feel free to take breaks. You can focus on your breathing. You can focus on relaxing your body, but I want you to stay in your body and as much as you can control what is inside your control, which is your hands, your feet, your breathing. You may feel all kinds of sensations. Let them go. Let it flow through you. Don't resist. Let that panic move its way through you. The more you resist, the longer you're going to hang on to it. Let go. Let it work its way through you. It's done that before. It has let go of you before. You've been okay. You're going to be okay. You're going to get through that.